Thanks, Dorothy, and thanks for inviting me to speak in front of such a terrific crowd. I'm going to briefly talk about something called sleep apnea. How many of you know what is sleep apnea or heard about it? Oh, quite a few. Okay, so I don't need to talk anything then. Okay, how many of you snore? So, okay. Not many people want to reveal that, right? Anyway, sleep apnea is a very common condition. It's a common condition that causes sleep disturbances at night. It's a condition where a person, when he goes to sleep, repeatedly closes his throat. So basically, apnea means it's not breathing. But in true sense, the patient is actually trying to breathe harder and harder against a closed throat. So each time the throat closes up, the brain wakes up briefly and the airway opens, the patient is able to breathe, falls asleep, and then closes it again. And this cycle repeats several times throughout the night. And there are several risk factors for this sleep apnea. The main risk factor is obesity. But not all patients who are obese develop sleep apnea, and not all patients who develop sleep apnea are obese. So there are several other factors that play a role in the development of sleep apnea. And there are certain genetic factors and certain other conditions like hypothyroidism that can cause sleep apnea. The diagnosis of how the patient presents with sleep apnea, the most common symptom is snoring and the daytime sleepiness, daytime tiredness. The patients don't wake up after having a refreshed sleep. And if this happens, they should seek help, because diagnosing this and treating this condition is fairly simple, and majority of the patients can be treated successfully. So a sleep study basically involves monitoring somebody's brain waves for sleep stages, monitoring their airflow, oxygen, heart rate, and breathing movement, so we can assess their sleep apnea, how many times they stop breathing, and other things. And if they have sleep apnea, there are various treatments that we can discuss with, starting with weight loss and good sleep hygiene. The main treatment and the most effective treatment is something called Cpap, which is short for continuous positive airway pressure. Basically, this is a small machine that delivers air under pressure to the back of the throat, so it keeps the throat open. Basically, it splints open the throat, so the throat doesn't collapse when a person goes to sleep, so the person can breathe in and out without any obstruction, so thereby giving more continuous sleep, and also eliminating any the low oxygen states and the stress states that the throat closure can cause. And there are other forms of treatment like dental device and surgery in selected patients. But once you've been diagnosed, the treatment options can be discussed. So if you know somebody who is snoring and not getting a restful sleep, or always tired, sleepy during the daytime, make sure they seek help, and because this condition is easily diagnosed and easily treated. Thank you.
Thank you.